there is a rising trend among physiotherapists who are stating that disc bulges are normal. Everybody will have disc bulges, so don't worry about your disc bulge in the MRI. So these people are belittling or disregarding the fact that the disc can cause the pain. I accept the fact that 30 to 40% of the younger population would have asymptomatic disc bulges, and 70 to 80% of the older population would also have asymptomatic disc bulges. But just because some are having asymptomatic disc bulges does not invalidate the fact that disc bulges can cause pain. Do you understand? So 90% of the surgeries happening in the world for the spine, in the cervical or in the lumbar, they are all done for the disc bulges, disc sequestration, disc herniations that is causing the sciatica and radicular pains and so on. Even cardiac lesions is because of the disc herniation. Do you understand? So when the surgery in the world happening for the disc diseases, why do we underrate the fact that disc can cause the pain? Do you understand? So as a physiotherapist, we need to accept when the disc is the reason for the pain, accept that the disc is the reason for the pain and treat the underlying discogenic pain. And most of the physiotherapists does not even know how to diagnose a discogenic back pain. They do one SLR and they do one prone bend test, and then they say that the test is negative, so there is no discogenic pain. It's so complex than what you actually think. So a wise physiotherapist will do a subcategorization of the back pain based on the pattern recognition and know that whether it is a discogenic pain or fasciculogenic pain or spondylolisthetic pain or even muscular pain or central canal stenotic pain or it is a organ referred pain. Just by giving some random strengthening exercises, by making your muscles strong, doesn't mean that the pain will go away. For the pain to go away, you need to diagnose the reason for the pain. Just by giving a non-specific strengthening exercise will not cure a specific back pain. In fact, there is nothing called non-specific back pain. It's something like non-specific chest pain. Can you agree on non-specific abdomen pain? Can you agree on non-specific jaw pain? We don't say so, because every pain has a reason. Just that we don't understand why there is a pain doesn't mean that the pain becomes non-specific. Maybe you can say that I don't know the reason for the pain, but don't use the term non-specific back pain. Alright. So a wise physiotherapist will always diagnose deeply and subcategorize the people and know the nociceptor or the reason for the pain. Of course, you need to consider the cognitive factors and then social factors, contextual factors. I'm not denying that, but that is not the elephant in the room. The elephant in the room is the structure which is causing the pain. Treat the structure, pain will go away. At least there's a chance that you give to the patient rather than giving a random exercises. Instead of following the herd, let's act like a informed, wise and matured physiotherapist.